Welcome all to the Bionics Institute. Many of you may be wondering how the Bionics Institute has gone from its foundation 30 years ago by Graham Clark in trying to invent the cochlear implant to trying to develop treatments for rheumatoid arthritis. One of the key things Graham did all those years ago was realize that if he could get electrodes in just the right spot and deliver small amounts of electricity to the ear, he could restore hearing. That was one of his great insights. One of the other great insights he had was that you actually need a team of people to be able to do that. He brought together engineers, physiologists, other scientists, clinicians, patients, all working together to develop that technology. No one individual could do it by themselves. Since then, the Bionics Institute has continued in that same spirit of groups of people from different disciplines working together to take that concept of using electricity to activate different parts of the body. We've developed the retinal prosthesis, returning sight to the blind. We've improved the way that we can stimulate the brain with deep brain stimulation to help improve Parkinson's disease. And more recently, we have started to look to see if we can use electricity to stimulate the body in other areas to help treat conditions that have typically been treated with drugs. And that's where we're at the moment. In fact, we were sought out by the United States government to start to develop one of these therapies to try and treat inflammatory bowel disease, which covers Crohn's and colitis. They sought us out from worldwide because of our expertise and our collaborators at the University of Melbourne and the Florey Institute to develop a new electrode array and a new device to be implanted on the vagus, which you'll hear a lot more about later from Sophie. And that device is hopefully entering clinical trial later this year. And it's from that device and the innovations we've achieved from that Sophie and Fallon have been able to develop the devices you'll be starting to hear about later today. So thank you all for coming, and I'll hand back to Anne now.